Welcome to Damal Consult Career Academy, your go-to channel for expert interview tips and career success strategies. In this video, we're covering the most frequently asked caregiver interview questions and answers for 2025. Whether you're applying for a live and caregiving role, home care assistant, or senior support position, this video will help you prepare confidently and professionally. If you want to stand out and win your dream job as a caregiver, stay tuned. We're sharing proven answers and powerful tips that interviewers want to hear. 1. Can you tell us about yourself and your experience as a caregiver? My name is Thomas, and I'm a compassionate, patient, and dependable caregiver with over 6 years of hands-on experience, providing care and support to elderly individuals, people with disabilities, and patients recovering from illness. I have a genuine passion for helping others and ensuring they live with dignity, comfort, and as much independence as possible. Most recently, I worked as a live-in caregiver for a private client and also provided support in a residential care home called Hope Haven Elderly Center. In both roles, I assisted with daily living activities such as bathing, dressing, feeding, medication reminders, mobility assistance, and companionship. I also handled light housekeeping duties and communicated regularly with family members and healthcare providers to ensure the care plan was followed accurately. Over the years, I have worked with clients who have dementia, arthritis, mobility challenges, and chronic illnesses. I've learned how to adapt to each person's unique needs, and I always aim to create a supportive and safe environment. In addition to my experience, I have completed training in first aid and CPR, manual handling, infection control, and safeguarding adults, which ensures I follow best practices in caregiving and health support. I'm known for being attentive, respectful, and emotionally supportive. I believe in building trust with the people I care for and making them feel valued every single day. I'm now looking forward to bringing my skills and experience to your team and continuing to make a positive difference in the lives of others. 2. Why did you choose to become a caregiver? I chose to become a caregiver because I genuinely enjoy helping others and making a difference in people's lives, especially those who are vulnerable and in need of support. From a young age, I've always been drawn to caring roles, whether assisting elderly family members or supporting people in my community. Over time, I realized that caregiving is more than just a job. It's a meaningful way to bring comfort, dignity, and companionship to individuals who may feel isolated or struggle with daily tasks. I find it incredibly rewarding to be able to provide not only physical support, such as helping with personal care and mobility, but also emotional support that improves someone's quality of life. What motivates me most is the trust people place in caregivers and the opportunity to build genuine relationships while promoting independence and respect. It's a role that requires patience, compassion, and empathy, qualities I value deeply and strive to practice every day. Choosing this profession was a natural fit for me, and I'm committed to giving the highest standard of care to those I support. 3. How do you handle difficult or uncooperative patients? As a caregiver, I understand that some patients may become uncooperative or difficult due to pain, frustration, confusion, or the emotional toll of their health conditions. I always approach such situations with empathy, patience, and professionalism. When I encounter a difficult patient, I first try to stay calm and avoid reacting emotionally. I listen carefully to their concerns and try to understand the root of their frustration, whether it's fear, discomfort, or feeling a lack of control. By acknowledging their feelings and showing that I care, I often find that patients begin to feel heard and more at ease. For example, I once cared for an elderly patient with dementia who would become agitated during bathing. I learned to approach him with a calm tone, explain every step gently, and give him choices to help him feel in control, such as choosing the towel or when to begin. Over time, his cooperation improved significantly. I also keep communication open with family members and the healthcare team to Ensure a consistent approach and share strategies that work. If a patient remains uncooperative, I follow the care plan and escalate appropriately if needed, always maintaining safety and dignity. Overall, I believe that patience, respect, and understanding are key to building trust and managing challenging behavior effectively. Before we proceed further in this video, if you're currently preparing for a caregiver role, then this is exactly what you need. Our 50 Caregiver Interview Questions and Answers ebook is now available for instant download. Click on the sealer or fourth wall link in the description box below to grab your copy. It's very affordable, and we're currently offering a 70% discount, so don't wait. And there's more if you're interested in a few extra interview tips, plus a free PDF with 10 bonus interview questions and answers. Just send us an email or a quick WhatsApp message. In addition to our 70% discount, we've got a special bonus offer: buy one, get one free. When you purchase any of our ebooks, you'll get one extra ebook of your choice absolutely free. Just send us an email or WhatsApp message after your purchase, letting us know which bonus ebook you want, and we'll deliver it to you within 48 hours. You can also join our exclusive WhatsApp group to connect with others preparing for the same role. The link is in the description below. Want personalized help? Book a one-on-one coaching session with us using any of the links in the description box. To order now, visit sealer.co or click the fourth wall link. For any questions, chat with our online support on WhatsApp or email us. Don't miss out. Get your copy today and ace your interview. 4. Describe a time when you had to deal with a medical emergency. What did you do? In my previous role as a caregiver at Rosehill Elderly Care Home, I encountered a medical emergency involving one of the residents, Mr. John, who had a history of diabetes. One morning, while assisting him to the dining area, I noticed he seemed unusually weak, disoriented, and was sweating heavily. He suddenly became unresponsive and slumped in his chair. I immediately suspected he was having a hypoglycemic episode. I stayed calm and followed our emergency protocol. I quickly laid him down safely, ensured his airway was clear, and alerted the senior nurse on duty. While waiting for the nurse, I checked his blood sugar level using his glucometer and found it was extremely low. I informed the nurse and assisted in administering a glucose gel as instructed. Once he regained consciousness, we continued to monitor him closely, and I documented the incident accurately in his care notes. I also spoke to the family that day to keep them informed, and we reviewed his diet and medication schedule to prevent a recurrence. This experience taught me the importance of being alert, acting quickly, and following procedures in a calm and efficient manner. As a caregiver, emergencies can happen at any time, and it's our responsibility to stay composed and focused to ensure the safety and well-being of those in our care. 5. How do you manage the emotional demands of caregiving? Managing the emotional demands of caregiving requires a balance of empathy, self-awareness, and professional boundaries. I genuinely care about the individuals I support, and I always strive to provide compassionate, person-centered care. However, I also understand the importance of looking after my own emotional well-being to remain effective in my role. One of the key ways I manage the emotional side of caregiving is by practicing emotional resilience, reminding myself that while I am there to support and comfort others, I cannot control every outcome. I talk to my supervisor or team members when I'm feeling overwhelmed, and I've found that sharing experiences with colleagues helps reduce stress and build a sense of support. Outside of work, I focus on self-care through regular exercise, rest, prayer or meditation, and spending time with family. This helps me recharge emotionally and maintain a healthy perspective. I also reflect on the positive impact I'm making in people's lives, which keeps me motivated and reminds me why I chose this profession. Overall, I've learned that by staying emotionally grounded and seeking support when needed, I can continue to provide high-quality care while protecting my own well-being. 6. How do you maintain the dignity and privacy of the person you're caring for? Maintaining a person's dignity and privacy is one of the most important responsibilities of a caregiver, and I approach it with empathy, respect, and professionalism at all times. I always begin by treating the person I care for as an individual, not just as a patient, by respecting their preferences, involving them in decisions about their care, and speaking to them in a respectful and reassuring manner. When assisting with personal care tasks like bathing, dressing, or using the toilet, I make sure to close doors, use screens or curtains where needed, and cover the person as much as possible to preserve their modesty. I also knock before entering their room and ask for permission before carrying out any task, even if it's part of their care plan. I make sure to listen actively and allow them to express how they want things done. If they feel in control, they are more likely to feel valued and respected. Privacy also includes keeping their personal and medical information confidential. I never discuss their care with anyone who isn't authorized, and I always follow data protection and confidentiality policies strictly. Ultimately, I treat every person in my care the same way I would want my own family member to be treated, with compassion, dignity, and respect at every step. 7. What would you do if a client refused to take their medication? If a client refused to take their medication, I would first remain calm and respectful. I understand that clients have the right to make decisions about their care, so I would start by gently encouraging them and trying to understand the reason behind their refusal. I would explain the importance of the medication in a clear and compassionate way, without pressuring them. Sometimes clients refuse medication because they're confused, scared, or experiencing side effects. So it's important to listen and provide reassurance. If the client still refused, I would never force them. I would document the refusal accurately and promptly report it to the nurse, supervisor, or healthcare professional in charge. This way, they can assess the situation and decide on the best course of action, especially if the medication is critical. My priority would always be to respect the client's dignity and autonomy, while ensuring their safety and well-being through proper communication and reporting. 8. How do you handle disagreements or conflicts with family members of the person you are caring for? As a caregiver, I understand that family members are often emotionally invested in the well-being of their loved one, and sometimes this can lead to misunderstandings or differing opinions about care decisions. When disagreements arise, I always remain calm, professional, and respectful. I make sure to listen carefully to the family member's concerns without interrupting, so they feel heard and understood. I then explain my perspective clearly, using facts and observations from my caregiving experience. And I always refer to the individual's care plan or medical advice when necessary. If the issue cannot be resolved immediately, I don't take it personally. I aim to find common ground, and if needed, I involve the supervising nurse, care coordinator, or manager to mediate and ensure the best outcome for the client. Ultimately, my goal is to maintain a positive and cooperative relationship with the family, while keeping the client's well-being and dignity at the center of every decision. 9. What experience do you have with assisting clients who have dementia or Alzheimer's disease? I have over 4 years of hands-on experience working with clients diagnosed with dementia and Alzheimer's disease, both in home care settings and residential care facilities. In my most recent role as a caregiver at Graceful Living Care Home, I provided daily support to elderly clients at various stages of cognitive decline. My responsibilities included helping them with personal care tasks such as bathing, dressing, grooming, and toileting, while always maintaining their dignity and comfort. I also supported meal preparation, feeding when necessary, and ensured a calm, structured environment to reduce confusion or agitation. Because individuals with dementia may experience memory loss, mood swings, or episodes of anxiety, I learned how to communicate patiently and clearly, using repetition and reassurance. I followed personalized care plans closely and worked with family members and medical professionals to report any changes in behavior or health. I also engage clients in gentle activities such as music, storytelling, and simple puzzles, which helps stimulate their memory and maintain a sense of routine. Most importantly, I treated each client with compassion and understanding that behind the condition is a person who deserves respect, empathy, and support. This experience taught me the importance of consistency, nonverbal communication, and emotional sensitivity when caring for individuals with dementia. I'm confident in my ability to provide safe, supportive, and person-centered care for clients with Alzheimer's or related conditions. 10. How do you prioritize tasks when caring for someone with multiple needs? When caring for someone with multiple needs, I prioritize tasks by focusing first on safety, medical needs, and time-sensitive responsibilities, followed by emotional support and personal care. For example, if I'm caring for a client who requires medication at specific times, mobility assistance, and personal hygiene support, I always begin by ensuring their medication is administered on time, as this can affect their overall health and well-being. Next, I assist with any mobility-related needs, such as helping them out of bed or to the bathroom, to prevent falls or discomfort. Once those immediate needs are met, I move on to other important but flexible tasks like preparing meals, doing light housekeeping, or engaging them in conversation and companionship, depending on their preferences and energy levels. I also make use of a daily care plan or checklist, which helps me stay organized and ensures that no part of the individual's care is overlooked. At the same time, I remain flexible, because caregiving often requires adjusting quickly if something unexpected comes up. By combining clinical awareness, empathy, and proper planning, I'm able to deliver well-rounded, attentive care even in complex situations where needs overlap. Do you have any question for us? Yes, thank you. I do have a few questions. Can you tell me more about the typical day-to-day responsibilities of a caregiver in this role? I want to ensure I fully understand the expectations and how I can best support your clients. What kind of support and training do you provide to caregivers, especially when working with clients who have specific conditions like dementia or mobility issues? Ongoing development is important to me, and I'd love to continue learning while on the job. How do you measure success or performance for caregivers in your organization? I like to understand what excellence looks like so I can meet and exceed expectations. What are the next steps in the hiring process? I'm excited about the opportunity and would appreciate knowing what to expect moving forward. And that's it. The most important caregiver interview questions, top-rated answers, and expert tips to help you succeed in 2025. If you found this video helpful, don't forget to like, share, and subscribe to Demal Consult Career Academy. We're here to support your career journey every step of the way. Drop a comment below if you'd like us to create videos on other job roles. And don't forget, with the right preparation, you can win your dream caregiver job.